Firstly, I would like to acknowledge the Gadigal people of the Eora Nation, who are the traditional owners and custodians of the land in which we live today. I would like to also pay respect to the elders, both past, present, and extend the respect to other Indigenous Australians who are present. On behalf of the RACP, I would like to welcome you to this evening's exam and wellbeing event, an initiative of the New South Wales ACT Trainees Committee. My name is Kiri Langford and I'm the co-chair of that committee. So I'd like to thank you all for coming tonight. Firstly, I'd like to thank our speakers who've given up their precious time this evening and sharing their valuable insights with us. And secondly, I'd like to thank Dr. Zanelia Chowdhury and Paul Kumar, who have organised this event but couldn't be here just now, but Amelia will join us later. I would now like to welcome Dr. Louise Ward to provide an overview of how to manage your health and wellbeing during the exams. Louise is a rheumatology advanced training at Royal Prince Alfred Hospital. She helps to design and implement and continues to be involved in a BPTOK, which is a wellbeing program for the physician trainees. Earlier this year, she enjoyed the role of medical education registrar at RPA, where she was involved in the BPT training program, running the local RACP examination and exploring new initiatives for junior training. Outside of that, she was trail running, the beach, and running around with a 2-year-old daughter. I'm George. Thank you.
Thank you very much. Thank you very much, everyone. I'd just like to say that it's a great privilege and honour for me to be here this evening in what I know is such an important time in your lives. And I just want to say all the best and well done for being here and for this journey that you're on. And I'm keen to know what sort of, where everyone's up to. So perhaps could you put up your hands if you're going to sit the written exam next year? Okay, and the following year? You want a couple of people. Okay, awesome, great, okay, that's very good. Okay, so tonight I'm just going to talk a bit about what Kiri's introduced me, thank you very much, but why I've been asked to come to talk to you tonight about managing stress in exams, and it's certainly not because I was an expert when I was a BPT, and then a bit about why BPTOK, and I'm not having tonight as a bit of a BPTOK showcase, but I think that there's some lessons that I've learned and I think that can be learned for BPTs, and then just to talk about what parts of BPTOK have been successful, and then how you could make your own sort of program or shape things in your own life moving forward, particularly for the next 18 months, but also for the rest of your careers and how you can help manage your stress. And then I just want to do a couple of practical things. So this is me and my son George, and I was a BPT in 2015 and 16, and I was actually pregnant for both of my exams. And towards the end of my BPT, I went on maternity leave and then commenced a project in BPTOK research, or a research project looking into the health and wellbeing of the basic physician trainees. I certainly found it unexpectedly quite challenging to manage some of the stress that was associated with the BPT training. And I remember, I could remember back to being a med student and getting this checklist for burnout. And at the time, I'm like, oh my God, that would never apply to me. I just wouldn't even come into my training. But then I found quite a lot of areas of BPT challenging, and I thought I was the only one. I didn't think anyone else, looking around you, everyone's so capable, and I thought everyone else had it completely together and that I must be the only one feeling this way, which is not the case. So tonight I'm just keen to share with you a bit of some things that I've learned along the journey. I've got a few slides on some facts and figures about why we started BPTOK, but I'm quite sure that probably everyone in this room realises why something needs to be done. So of course you probably know about a lot of big studies that have shown quite high rates of burnout and stress and depression and anxiety in junior doctors. But I don't want to harp on about that because I think we're all aware. And then there's just a couple of slides on the impact of that. Sorry, that's off the top, but so it can impact on us all as doctors if we're feeling quite stressed or burnout in this case. And I mean, it's not surprising to see there's evidence about it reducing empathy and compassion, for example. There can be a big impact on the organisation, again, because of the impact that it has on individual doctors. And of course, that can flow onto patient care, and there is some data showing impact on errors and complaints and patient satisfaction. That's not the focus of the talk because I don't really want to make it a didactic session. And I wanted to talk a bit more about how we came up with BPTOK and what happened and what could be next. So the big group of many of us who were interested came together, so past and current BPTs, of which I was one, and some recent trainees or training directors, psychiatrists, psychology, to come up with to come up with sort of a curriculum and then to work out how to put that into play. So we're really keen for BPTOK to start a conversation about junior doctor wellbeing. And we were keen to make it a preventative approach so that this was applicable to everyone going into BPT because there, as I'm sure you're well aware, and I don't need to tell you, but the job pressures of the long hours and then study and trying to see your friends, they are real, and it is, you're not abnormal if you feel the stress of that. One of the great things I think that BPTOK has developed is that, or has shown that these skills that help looking after your own self and stress really can be useful in helping look after your patients, and particularly for the clinical exam it can be useful, but more importantly for day-to-day practice with patients. And BPTOK, we really wanted to create a healthy workplace. And one of the key things we wanted to get across, which is still a difficult concept to understand, is that we want to value the skills required for maintaining our psychological and physical wellbeing as much as other life-saving skills like CPR, which we have, full weekend courses on and get assessed on. It's required by the college. And our BPTOK has a couple of arms. So we have both psychological and physical components. So the physical components, we have a personal trainer for our group of BPTs once a week and a yoga instructor once a week. And then we've had some psychological components, including a mentorship program and many workshops, and we'll talk about some of those, and some mindfulness-based stress relaxation course. Yeah. There's been some really good, people have found that this targeted thinking about and planning for their own self-care and wellbeing can have really good impact on stress and the work-life balance. And one of the great things about BPTOK has meant that it's sort of driven organisational change in helping get extra covers for ADOs and protecting lunch breaks and many other wellbeing activities. So then that's all, might be a bit hard to apply to you. But then I was thinking about, so people here, if you're not in a hospital where there's a structured approach to what you can do for your wellbeing, I think one of the biggest things that we've learned from BPTOK is looking out for your peers. So I think that's one of the biggest things we can all do is ask each other how you're going and looking out for people. If you see that there's any signs of burnout or loss of empathy or not as engaged as they work or feeling that they're maybe not caring as much as they used to or they're snapping, other things like that, to really think about taking that next step and asking if they're okay. And then one of the challenging things can be what to do for someone if they're not okay and if they've confided in you. And this happened to me, not just where I'm working, but friends across many districts who weren't okay during BPT, and just the struggle of trying to help a friend who maybe say, no, I don't want to see a GP, and trying to navigate what to do from there. And so I think the Director of Training can often be a good first port of call, and they're keen to know that all networks, I think, have employee assistance programs. I think GP and the Doctors' Health Advisory Service and psychologists are a good place to start. But then there could be things like more practical things that you could start at your network, like having a regular debriefing session, which is something we found really useful at RPA. Like, for example, once a fortnight, just everyone meeting up for coffee 20 minutes before the start of work for a bit of a debrief, have a quick chat, and you can check in with people. And just gives, sometimes just being able to have a quick chat about something really stressful that happened on that evening shift last night, or just might not be coping that well with interaction in the workplace. I think these little check-ins with people, I think, could be really useful. So if you were interested, you could be the person in your cohort at your network to suggest, why don't once a fortnight we have coffee, maybe there'll be funds from the RMOA Association or something like that. You could be that person. And similarly, you could suggest a group exercise thing, such as even just a short walk together or run together before work. And I know some of this seems impractical, but one of the best things that we've learnt from some of these things we've been doing in RPA is you don't always need a lot of time for these things. One of our personal trainers has a session that's about 6 minutes long and can be really useful. And one of our trainees, who's now finished his exams, he found it extremely useful to do. He's downloaded an app, which I've got at the end, which is, there's a few apps like this, that one called 7, and it's 7 minutes of exercise. And he found it really helpful each morning to do a 7-minute exercise routine using an app on his phone. It might not sound like much, but I think, one, it's better than doing nothing, which sometimes you find it really difficult to fit exercise in. You can't get to the gym or go out for a swim or a run, but just 7 minutes before you get dressed in the morning for work have a really big impact on mental health and physical health. And this is just something I found on the internet, but I quite liked it. And it's about self-care, and it's not just about salt baths and chocolate cake, but it's about making choices to build a life that you don't need to regularly escape. And I think that's a really important thing, that when we're so busy, we really need to structure it in, like literally put it in your diary. And if that means like putting it in the diary to have coffee with a friend and it's a guilt-free break, to do that, or even if it's one walk a week, if it's currently 0, to put it in the diary. But I wanted to get onto a few practical things, and these are a few things I've learnt from my time this year. And I know some people have skirts on, so they might not like to do it, but I just wanted to demonstrate, and please feel free to get involved. But the astronaut pose, if anyone's keen to join me, so that we lie down on the floor and put our feet up on the, oh, now switching the microphone. Just put your feet up on the chair. Julie. And you can move the chairs around. Yeah, lie on the ground if you don't want to crash anyone. Feel free to close your eyes if you want to. And people who aren't on the floor, feel free to close your eyes. And then I want you to think of a square. And this is just an exercise to concentrate on your breathing. So you're thinking about a square, and you're thinking that you're starting in the bottom left corner of the square. And you're going to breathe your way around the square. So as we're going to go from the bottom left up to the top left corner. So you're going to imagine yourself going along that side, and you're breathing in, 1, 2, 3. So you're going, and then you're holding your breath as we move across the top of the square. And we're going down the other side, 1, 2, 3, and holding out, 1, 2, 3. And breathe in, moving up the left side of the square. Hold and out down the right side of the square. Breathe in, up the left side of the square.
Moving across the top, holding, and breathe out down the side of, right side of the square. And when you're ready, if you'd like to open your eyes, you can. Just take it in your own time. And when you're ready, you can sit back up on your chairs. Next, I want to do one little exercise, and I think you'll have received a handout. It's the back of your handouts. It's on goal setting. So this is one exercise that we have done, and it's talking about self-care, and it's making a self-care plan. And there's lots of parts of self-care, but some of the ones that I think are really obvious but hard to do are sleep, food, and exercise. And also sometimes personal relationships, if you feel like you're not catching up with your friends. So how am I going to time?
I'll tell you in 2 minutes.
So what I thought we might do is I might give everyone 1 or 2 minutes to have a think about some of these things. And like, for example, sleep. Who is getting enough sleep? Is everyone happy with the amount of sleep they're getting? And if the answer is no, then stop. You could stop at sleep and have a bit of a think about, why aren't you getting enough sleep? What's stopping you from sleeping enough? Like, I know one big thing for me is spending 45 minutes on Instagram or something like that. So now I've charged my phone in the hallway next to my room, for example. But think about the things, what might be stopping you from sleep, or what might be stopping you from having a healthy diet that you like, or exercise that you like. Have a chat to your neighbour if you like, and talk to them about tips that you might have. But then I want you to think about it in the SMART goal approach. And this is something I use with patients in the clinic all the time. And I'm doing rheumatology, but I still don't talk about weight loss, smoking cessation, alcohol, exercise all the time. I'm getting them to think about these SMART goals, and it really works. But it also can work for you. So have a think about, for example, sleep, and try to come up with a goal for yourself and with something measurable and specific about how you could get better sleep in the next 2 weeks. I'll give you a couple of minutes. There's room over the other side of the page if you wanted to make any notes about how you think you could structure sleep into your life.
Yeah, just like straight and outside. That's all the thing for one house. Oh, okay. I'm actually meaning to doing that. Yeah. I thought that was part of it. I go to the gym because he sees me no, swimming I might just interrupt for the sake of time, but I hate to interrupt because I think this discussion can be really useful because you can get lots of ideas from each other.
And then it can help you realise that it is really important just to get the basics right. And I'm someone who's, been involved in BPTK for 18 months and still I really need to work on my physical exercise. Even though I said I like trail running, I still don't do it as often as I'd like. I think I'm getting sleep a bit better and nutrition a bit better, but it's so hard for everyone. It's really hard to get these basics right. But I think to know how important it is for you and to try to think about some specific things I think can be really useful. So these are just a couple of the apps. Some of these apps are I've given you a couple of tables of some resources I think could be useful for people who are well, for people who are not well, people wanting some more information. And some of the apps, there's lots of apps for meditation, and one I've used Calm, this app, which I find useful and can be ones for meditation and ones for getting into sleep, different things. And I actually haven't ever paid to sign up. I just use the free thing. But there's a couple that you can use on the free ones. And Smiling Mind is another good one for meditation. And then this is another good one that I learned about during, in BPTK, we had a couple of workshops where we just looked at that self-care thing, those goal setting, and we had groups of about 15, so a couple of 3 groups within our BPTK cohort. And we all had a big discussion about each of those, sleep, nutrition, activity, and all talked about our problems and suggestions. And I got lots of great ideas from that. And one of them is worry. So I don't know if you're a person, but I'm kind of this person, say if you came home from an evening shift and then you're like worried about all your patients, or it might not even be just directly about patients, but you're worrying about all these things, like I haven't written that presentation and I'm supposed to finish those questions, and like how does it help you get to sleep at night? It does not. So then you can add a worry, and then you give yourself a worry time. So you write all your worries in there and you say, I'm going to next worry about this at 8 a.m. And then you write it on this paper and it scrunches the paper up, and it doesn't unscrunch until 8 a.m. So you're just not even allowed to worry about it. It doesn't even exist then because it's not going to help you anyway. So I thought that was quite a clever app that I've used a couple of times to stop me worrying. And this one is that 7 app. There's 7 minutes, just how to do a quick 7-minute workout. And there's so many more, there's so many great apps, and sometimes there's a bit of a balance with the apps, but then you don't spend too much time on your phone. But they can be useful. And some general tips I think I had. Sometimes I think that BPT study process can be really competitive, and you're in with lots of other high-achieving basic physician trainees, which sometimes can not make you feel very good. So I think it's a good idea to surround yourself with people who make you feel good. Not the people who might say they know all the answers to all the questions, which they don't, but it might feel like that. But just surround yourself with people who make you feel really good. And similarly for the next one, don't fall into the trap of comparing yourself with others, which is really hard. And I think keep some perspective on this is a really important exam, but it's an exam. One way I got perspective, which was not why I did it, but being pregnant gave me perspective, because I thought, I can't be so stressed that I'm going to jeopardise my future child. This is one exam I've got to still have my life. I've still got to do these things to look after myself. And then connect with purpose, which I think is a really important one. So that's thinking about why you wanted to become a doctor and what do you like day to day about becoming a doctor. And for me, that can be, I grew up in the country and I love it when people come in from the country, patients might come into the city and we have a chat about, their sheep property or little things about, their pets or something like that. And you just have this quick chat. It doesn't have to, I know it takes so long to admit a patient and everything like that, but you can just have a bit of banter about their pets, something like that. Love it. Just love it. Just to get that connection with people. And even though you're so busy, if you can just try to pick out what those things are that really made you want to become a doctor and make you really feel good about what you do, and try to think about just spending even sometimes 2 minutes a day or a couple of times a week on making sure that so you can remember and connect with your purpose in medicine. And that's all I have to talk about this evening, but I'm happy to take a couple of questions.
I ask a quick question about BPTK.
Yeah.
How did you manage that around
Is it much different in adults? So as peds trainings, we do shift work right until then.
Oh, yes.
So I'm just trying to think how you would schedule.
So we had all, or not all, but most of our BPTOK sessions are in protected teaching time. So all of the psychological sessions were in protected teaching time, and some of the exercise classes are in protected teaching time. But at the moment, the yoga is at 6 p.m, which is not. And the exercise has been sometimes in our protected teaching time, like if we might have 1 hour of clinical prep and 1 hour of exercise, or it's after that. So there's always some people who are on nights or maybe away from Sydney in that week after nights, or are carrying the on-call pager or working at shift, and they can't always come. So we try to get as many people as we can by having a lot of the sessions in protected time, but it's sort of goes in peaks of who can attend. We might not have night shift work, but we do have a night shift, that sort of thing. It's just like all the other teaching that they attend if they can. Yeah, questions? Thanks.
Hi everyone. Thanks to the college for the opportunity to talk today and share some of my tips and experiences for the written exam. So just to re-clarify with the adult group only, who's doing the written exam in February of next year? Most people, and the following year, great. So I'll try and sort of, don't have the mindset that you're not going to pass. So this is quite a general overview about starting with this, but I'll try and tailor some more specific tips on what preparation of the day. And who's already been to a revision course? All right, great. So we'll talk a little bit about the revision courses as well. So that's the typo there, so 2019, is the date, 18th of February, not 2009. So, and the good thing for you guys, most of you guys, is it's actually back in the written format, is my understanding from the college for next year. So as a consequence, you don't have to worry too much about technology and how to manage a computer system, etc. As you all know, there's 2 papers, clinical applications as well as medical sciences. My understanding also is that the options are being cut down from 5 to 4. So I guess it's a good thing in terms of your odds of getting something right is higher. And there will still be extended matching questions and any questions for those. I think the important thing to think about is that the written exam is also sort of the concrete knowledge part that you will need to take into your clinical exam. And it gets a lot harder if you haven't comprehensively covered the knowledge, because in the clinical exam you're also facing the patient, and the examiner is quite focused on seeing how you can apply your knowledge to the patient in front of you and make it really about patient-centered care. So you're building towards the clinical exam, but also as well-rounded doctors as you head into advanced training programs in the future. So you're not just studying for one MCQ quiz. So overall approach, so I think the 3 key things I found quite useful throughout the year, which is a bit of a marathon preparing for the written. Firstly, study group. Is everyone here in a study group of sorts? Because I think it's really quite useful and important to have a group of colleagues. You don't necessarily have to pick your closest friends, but people who you can get along with, who maybe have slightly different interests and expertise, who can help get you through that year. And so then you're committed to meeting up on a regular basis and covering all the questions that you have to get through in a sort of steady manner throughout the year. Think about how you like to study, and I think by now most of you would probably have accumulation of lecture notes and listening to PEP lectures, and be thinking about how best you consolidate knowledge as you head towards the revision courses and beyond.
Some people like to read and highlight, other people like making their own notes. I found that Enki, I don't know, has anyone heard of Enki, using Enki? Yeah, I found that quite useful. There are actually decks of old questions and decks of like Enki question and answer combinations for written and clinical exam. Other people have done, but maybe the most useful is to make your own deck, because everyone's different in what knowledge they can and can't remember. For those who aren't familiar with Enki, it's a flashcard app system, and it helps you with intelligent revision, because every time you click you can't remember that answer, it will keep bringing it up until you remember. So it sort of forces you. And you can sort of do it whilst waiting for your coffee, at the bus stop, whilst your consultant's going on a rant, on a ward round, and that sort of thing. So I think it's quite time efficient when you turn study. And then lastly, so I think the revision course is quite useful. It's very intense though. So this is just an accumulation of all the photos we got in one revision course of our colleagues and pets falling asleep on lecture notes. And it's essentially about learning all the medicine in 2 weeks' time. But I think when you walk away from the revision course, you suddenly realise there's actually quite a clear syllabus of the kind of questions that come up, and it makes it all seem a lot more manageable, because from going before the revision course, it's really hard to know how much you need to know, and so the lectures pretty much cover it quite well. So I think that's a really good opportunity, and try not to burn out before the revision course. So try and taper down your study a bit so that you can make the most out of those 2 weeks. So in terms of study groups, so most people probably are already in the swing of things, but having a regular timetable, if you can, try and cover all the subspecialty topics, at least some of the recent questions in the MCQs, as well as lectures just before the study course, so you have a basic understanding, and then you can go in and try and consolidate that learning. I think 5 years is probably on the upper limit of how many years back you have to go back to review the questions. And the other thing is everyone's in this together, so I think sharing resources is a really good thing to do, both within your hospital but also across hospitals. We had a Dropbox, and everyone sort of pulled resources and got previous year's EPTs to also put their notes and resources in, because there's no point sort of reinventing the wheel. A lot of the PET lectures may not change, and people probably have created notes already, so you don't want to be making notes from scratch. If other people have already done a good set of notes based on the PET lectures, you can just update those or print them and annotate them as you go along. And then with study group as well, don't just make it about work, so try and make like on a regular Friday afternoon catch up over a beer and talk about your day-to-day job, and try and also make it about an opportunity to debrief. And I think that really helps because it's going to get stressful towards the end. So specialties, you all know what the specialties are, but I just wanted to really emphasise, and I didn't really realise this towards the end, but there's a couple of topics that come up year after year which are super high yield. So clinical pharmacology, genetics, statistics, maybe some of Jerry's, I think much less of obstetrics, psych and derm. But those core clinical areas that you often don't really use day to day in hospital and on your ward rounds, they actually do come up. And even if you go back to the college's previous papers from like 1995, those sort of questions, and you'll see those genetics, family tree, pedigree diagrams, and trying to calculate what type of relative risk and odds ratios and all those sort of things. Those questions always come up, and if you can master those ones, it's a lot more efficient than trying to memorise the last 5 years of papers in the New England Journal of Medicine, because the chance of you getting questions on that is much lower. So I think really spend some time, and if you don't know or you're not very confident, there's a lot of pharmacologists in your hospital and geneticists who you don't see, but I'm sure they'd be very happy to run a 1 hour session with you guys. And we've got a few of those people to help us, and I think that was really useful. So that's something to think about and approach your DPET about. So there is an endless sea of resources, and you can just see from this that really there's no shortage of past question banks, of notes that is really out there. So I think it's about being selective on what's highest yield, and sometimes using, as I mentioned before, things that other people have already collated for you, so you don't have to go back and do everything. So one thing to be aware about is BPC FOMO, and I think we all sort of suffer this a little bit because there are increasingly more and more courses out there coming out, not just on the revision course, but like subspecialty things. I think there's an immunology one. I went to that one mainly because I'm doing medical oncology, and I thought I kind of need to understand immunology for my own sort of career future using immunotherapy. But then there are other ones for genetics and other ones on MCQ questions and other ones on investigations, and sort of it's quite an endless sea to a point where I got ordered to, or they threatened the tax, when I did my tax return, they threatened to audit me because of all the expenses that I had accumulated. And I think it's quite common during BPC that your income actually drops because you're spending so much. So I think you don't necessarily have to do everything, and try not to sort of compare yourself to what other people are doing. And if someone is going to a course, maybe see, you know, can you exchange resources, and people are happy to sometimes share MCQ questions from an MCQ revision course. You don't all have to go to everything. In terms of lectures, so that with the PET lectures, I think they can be a bit overwhelming because there's so many coming out every week. Some people listen to the lecture at increased speed. I didn't really do that. Maybe you can, you know, do it in amongst having a dinner together with the study group just to make it a bit more fun. MCQs, I think there are a lot of recall-ish type questions out there. I think the difficulty is on the stress of the day. People don't recall questions comprehensively. So you look at a question and really there's either multiple correct answers or no correct answers, and that's just because of the way that question's been recalled. So don't stress too much about trying to always get the right answer for that question. So it's more about thinking about why they asked that question and studying around that topic, I think, because it's if they reproduce that question word for word, that question actually is not going to count. It's just sort of used as calibration. So I think it's important not to take the MCQs themselves as seriously, but to use that as like the scope of what to study. In terms of journals, so are you guys running journal clubs in your hospitals as well? So some training networks sort of do a journal club where once a week we get together and then talk about some relevant papers in each of the specialty fields. I think it's not essential to have to go through those papers, but I think worthwhile thinking of some of the, perhaps just New England Journal of Medicine, some of the big papers that have come out in the last 1 to 3 years. Don't pick papers that are coming out now, because I think the questionnaire has already been set and finalised by now. So I think of 1 to 3 years, so about 2015-ish, 2017, and they may, you know, ask about questions. But in cancer and oncology, they have been asking about cancer immunotherapy, because that's been a pretty hot topic in the last couple of years. So I think this can be sort of a backup if you run out of other things to study, but I wouldn't go to sort of journals as a source for study stuff. Guidelines are really good, so especially things like antibiotic guidelines. So ETG Complete is a great resource. And then there's a lot of different other subspecialty specific guidelines. I didn't really use very much of those, but if you were uncertain about an answer to a question, then maybe go into one of the guidelines for a specific subspecialty topic would be handy. Some people use MKSAP. This is an American-based syllabus. I think it sets out the information in a quite easy to digest format, and it's colourful and pretty and nice to study from. Quite expensive as well, and there's also lots of MCQ questions which can be handy. So something to think about, but I don't think mandatory as well. And so for the study courses themselves, so what will happen is over 10 days, you'll be sitting in lectures from maybe 8:30, 9 a.m. till about 5, 6 p.m. All the courses at the end will run an exam, and most of those will also then plot you on a bell curve with the results of that exam. So it can be quite daunting, and it's a lot of information. You walk away with like this much notes. So consider that when you're booking your flights and for luggage allowance. I think it's a very good experience, and I think try and, when you go there, during the day study, but in the evening socialise, go out, have nice dinners for yourself, get a massage, things like that, because it's quite intense and you really don't want to burn out and fatigue, because it's quite an intense 2 weeks. But I think at the end of the revision course, most people find that you sort of know what you don't know, which I think can be quite reassuring, because then you can pace your study over the Christmas and the summer. So bringing it together towards the last few weeks, I think make some key summary notes of things that you think are high yield that you want to sort of go over, and then make a plan of how to cover sort of MCQ questions. And then towards the end, I think it's very useful to be doing just the MCQs and trying to do them in the format of the exam under time pressure without distractions. And there's some list of where you can get MCQ questions in databases. So that there are a few books that have MCQ questions, and then online databanks as well. And practice as you play. So this is like sitting the exam as is. I think it's quite handy. I also printed off the blank templates of those answer sheets, and then practiced answering using that, because you never know in the real exam on the day, if you miss a line and put in 2 coloured dots on question 16, and then everything else, the alignment goes off, you could potentially get everything wrong because of that. So try and practice using those sort of sheets, which is what the college does. Sometimes, depending on what MCQ exam you're doing, there's also statistics on how you went and what people answered right and wrong, so that I think that's also quite useful to look at. And finally, I think it's really hard because you're all working full-time jobs on top of studying for this big exam. It's very stressful. I think it's important to have some work-life balance, as Louise Ward mentioned. And I think it's important to exercise also. If you have some time off, think about maybe taking a study elsewhere. So I went to Bali maybe a few weeks before the exam, and took my notes and had time where I could study, another time where I sort of had fun, and I found that quite useful. So try and sort of keep a balanced perspective, because after this, you then have to ramp up to the clinical exam, and it's pretty stressful. Alrighty, so thanks everyone, and let me know if any questions.
In terms of your study groups, you talked about setting it around the MCQs. So you pick a topic, find the MCQs relevant, and then just discuss them, or?
Yeah, so what we did was we went back, say, 4 years of sort of recent recall questions for cardiology, and then before our study group, each of our study group members prepared the answer and the research behind each answer for about 3 or 4 questions. So then when you came to the study group, you could then go around and discuss each question and then go through the answers for that. So everyone had homework to do. So when you got to the study group, it was all about presenting your findings essentially for that question. Yeah, I think there's different ways to run it, but that's the way we found useful.
How long before the exam did you switch over to just churning through MCQ?
I think it wasn't a concrete, I'm going to stop studying and then just do MCQs, but I think there was a tapering off, I think maybe December, January of doing the revision, and then ramping up of doing MCQ questions. But I had like nice summary notes from the revision courses, and I remember studying those in the weeks beforehand. But rather than, by that stage, I stopped looking at lectures and textbooks and things, but it was all about the super high yield things. Yep. Great, all right, thank you.
My questions for the panel at the end.
So, the person who organised this event is not actually here. So, I actually got invited to speak. I didn't just invite myself to speak. But now I have to introduce myself because Amelia's not here. So I'll just do that while we're waiting. Sorry to people who might not listen to this lecture. So I'm Kiri. I'm first year advanced training. And I did pass my 20%. But it took me 2 goes. So that's why I wanted to speak to you, because I felt like I had quite a lot of knowledge and I would like to talk about what I did differently the second time. And I think a lot of this advice will be more, not more specific, but I do my training at George Hospital, which is a busy network, so it's about time management, as with everywhere, and also, yeah, so that's our cohort there. My main message is that passing the clinical exam is about structuring your time. So you have about 3 months after you find out when you passed or not, and you really need to allocate that time quite carefully, and you won't feel like working because you're going to be pretty cooped after your exam. But if you get a diary, so I have a phone diary on my Google phone, and I would block it all out, different colours, and just make sure you're very clear about how you're going to allocate your time. So, and block out family and exercise time as well.
I'm so sorry, Kerry. The people on video, we can't change them. However, we can record it and send to them.
So people on video, we can't change it, but we are going to record it and send that to you. So you can listen and come in, or you can take a coffee break and come back to us and come to you. And most hospitals will give you a roster about short and long case allocation. So make sure that you take that into account as well, and which bosses you'll be presenting to, etc. So harping on about that point. So if you use every week you've got from when you find out whether you pass or not, do a case every week, you're going to have at least 18 cases done. And 36 you do 2 per week. I found there was a lot of value in going home and presenting once, taking that feedback and presenting to a different boss, trying to get yourself an extra mark just by changing your presentation style, particularly if you're at time pool. Don't tell them you're doing it, but they know you do it.
Sorry, I don't understand that. So
you
find another box and present the same case.
Yeah,
right.
yeah, but you'll have your cards or your manila envelope, but make sure you go and revamp it. So, I mean, if you've got 6, you don't need to present it again, but if you've got anything less than 5, 6, then you can go home and take their feedback and just try and change your presentation style or your knowledge that was lacking and try and get an extra mark, because everyone knows how to take a history examination. That's not what this is really assessing at your level. Does that make sense now? Yeah. So on that point, there'll be common topics that will come up in a lot of long cases, so metabolic syndrome, alcohol, smoking, and you can pretty prepare an answer for that, because you just need to insert the name of the patient or the age of what is relevant to them, so you can have a really quick thing to say, so you can focus on what are the other problems are. You might be thinking time about that, how you're going to say that. The long cases are weighted 3 times as much as the short cases. I don't know why they marked out 210, but yeah, so and then the pass mark is 120, but you do need to pass a short case. Regarding the short cases, find a good way to share with your colleagues good cases around your hospital. So we have a shared email list, so each hospital for longs and shorts. Probably wouldn't be smart to do it on like WhatsApp or something, but there are ways in each hospital to share cases amongst each other. I think it's they have a resourcing checklist of short cases where you can, like they've made from Tally and O'Connor, like what the steps are. So then you can, someone else can mark you about what you've missed, particularly early on when you're learning it. And when I was on a really busy term, I actually had my Jane Lowe who wanted to do EBT. She would mark me on ward rounds. So it's just something you can do. And I would encourage you to think about going to other hospitals on the weekend, perhaps particularly if you have a busy term, because your mind's a bit fresher, you're able to take it all in, and it seems like torture, but it is a way of seeing different types of cases. You do have to get permission though, so don't just go, you need to get permission from their GPAT in order to get. And it's marked over 7, so I say that try and be getting 5 so that you can get 1 mark less on the day and still pass. This is on the internet, so I haven't released it again, but Google that, and that's the most common short cases that were in 2009. I don't feel it's changed very much. So I would make sure you won't get to see all these cases, but you can do a flashcard on each of them and make sure you know, like mitral regurg, what other causes, etc. For the questions asked afterwards. So I just made some do's and don'ts. I'll just say, do make time for the things that are important, because if you feel good about yourself, you've got to feel like you're a little hot doctor. You know what you're doing, so you need to see your friends and exercise, or you won't feel good about yourself. And I think you have to get over yourself early. It's very awkward, especially doing it in front of your peers, but just get used to coming in with your box and saying, I'm Dr. Langford, blah, 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 because it gets easier and then you don't have to think about it closer to the time. And it's quite a nice time in the hospital, like everyone's pitching together to get you all through your exams. So you just know that it will be over soon, and try and get obsessed with your clinical medicine and make it fun and work with your colleagues. And there are courses available for the clinic as well. I found the Canberra course very good, but I think there's one in Brisbane that's quite good as well. And I found it valuable to keep meeting my study group to talk about the different topics that I mentioned, making palm cards, etc. So don'ts that these are collated from my colleagues at Campbelltown as well, other advanced trainings, but I don't know why, there just seems to be this tendency to get really,
I was reading, sorry.
to get sneaky and start hiding cases, and I don't really know why, because you can all pass the exam, but maybe it's just the pressure of it all, but I think it fosters a negative attitude, and it sort of filters to everyone, and I just wouldn't do it. It's a hard time because you're already exhausted from the written, so just you're normal if you have a cry on Sunday when you have to go back to work. And find out, you probably already identified your support network for the written, but just let people know that you're going to be like a good friend again when it's August, but you might need to call them in tears on an occasion. And also try to do a case every day. This is a short case, and even on the days you don't feel like it, because they're the days that will mirror the actual exam. So, you get to know how you perform when you're not feeling very good. So there's still value even if you do a crummy job. And just stay nice to everyone because you want to have a job next year as well. And don't forget your books. So these were the only 3 books I used for my clinical exam. You might have heard of Tally and O'Connor, but the middle one's very good for the neurological exam, and the last one's a good reference book for the kind of questions at the end, like what are the most common causes of mitral regurg. might just skip through this one. Oh, this is what I wanted to do. So I found this very valuable. So Amy Cuddy, since she released her TED Talk, Your Body Language May Shape Who You Are, it's become quite controversial and disproven, but I really liked it. So that's a power pose, that's Wonder Woman, and she looks pretty powerful, right? So I thought we might do a power pose together. And maybe some other ways. I wouldn't probably recommend doing the desk one. I think that it's just about thinking about how you look to other people and how you feel. So, can I get everyone to stand up? I want you to roll your shoulders back, put your chest out, put your hands on your hips, stand a little wider. And you're like standing outside the room, you're going to knock on the door and you're going to smash it. So just like try and think about how your posture is, because I found it really did make a difference. And the other one I like to do, you can relax now, is if I was like, don't do this in front of anyone else, but if I was going to the bathroom or something on the day of the exam, I just go into the mirror and go, yeah, and you just feel really good. And I'm already smiling, so think about trying it. Nice. I heard put the reference there, but just it's a 20-minute lecture and you might find it valuable. And very briefly, the best advice I got, and my colleagues got, so I didn't do necessarily all of this, but to your exam site, take a spare shirt, pantyhose, and someone you love. You will think it sounds really lame to take someone with you, like your mum or your partner, but on the day, it will make a difference. And if you can stay walking distance to the hospital, do. In the lunch break, please just go away from everyone else because you're just going to make each other feel worse. And you can't help talking about it and you need to rest because you've got to go back in the afternoon. And so you go back to your accommodation and get your loved one to prepare a meal for you so you can have a nap and then have a shower and put on a clean shirt because it's a different exam and you can still pass even if you're feeling terrible because it's a new section. And I didn't personally do this, but one of my colleagues said for women to wear a dress and a jacket rather than a skirt so it doesn't ride up or down. And just remember it's a performance. So you might act a little bit more florid than you would in real life, but that's what they want. So recuperation. And I'm like, no, just joking, you need to do job applications and you can relax. And then I just wanted to briefly tell you what to do if you fail. And remember, statistically, quite a few people do fail, but you don't want to, but it might happen. And it feels really terrible for at least a week. And just try and remember that you're not a failure, you just failed an exam. And you have many other things that are great about you that aren't even to do with you being a doctor. But you're not a bad doctor because you didn't pass the exam either. I think it's a fairly common thing to threaten to quit on the night, and my GP he rang me and I was in tears and he's like, just reapply and you can always withdraw if you change your mind later because I'm like, I can't do it again. And I think it was 24 hours and I'm like, I don't want to quit anymore. And when you're ready, which might be a few months, from when you find out, you need to think about why you failed and try and address that if you can. So reasons my colleagues who are excellent doctors failed the exam was they were on a too busy a term in the lead up and they just couldn't study. They may have had an issue outside of work, such as ill health or a relationship breakdown. One of my colleagues had a temperature of 38 degrees on the day and he didn't pass. Maybe you didn't study hard enough. Maybe you just didn't pass a short case on the day. And maybe, like myself, you get terrible performance anxiety in public speaking and clinical exams. So I'm going to show you what I did. I took drama classes. So that's me giving my performance at Darlow Drama and getting flowers afterwards. And it's led to some really wonderful things. I'm now a producer of a comedy show, and I met all those people through my drama classes, and they were such good friends they came to my wedding. So some good things can happen when you fail the exam. And that's it.
Great.
Happy to take questions till the other people join us, and maybe Jenny, would you take questions as well?
Yeah. I'll go in and remind them.
How much did you feel the drama classes helped with your acting on the day and your performance?
I think because I just get really, really nervous when I have to give an oral presentation. They teach you quite a lot of strategies to portray perhaps a character that's not really who you are. And it was just because it was really fun as well. But I'm not the only person I know who took drama classes. Like, not everyone needs to, but there are people who probably know who you are, but just get so nervous they can't really perform. So that's how it helped me.
Yeah. I didn't take any drama classes, but I did some performance coaching. And
yes.
the goal of doing that was some people, if you unexpectedly do really poorly in one station, if you can't get rid of that angst and worry and concern about how that station went, you can end up affecting your performance in all the subsequent stations, and you can do this whole year of preparation and lose it because of one stuff up. Yeah, so I think it's about helping you reset, like some of the breathing and relaxation strategies that they teach you is quite helpful.
Yeah, there's special psychologists that work just in the clinical exam as well. So that's something you can do as well, just like performance coaching. You know, like athletes have a whole team around them when they have to perform on a big day. And it's like, it sounds crazy, but it's similar because it's just one day in your life and it can affect everything. So you need to have the psychological skills to do that.
To amp up to the red end, when did you feel that you really kicked off your study? And was it hours a day with a day off, or did you not have days off, or did you find it was better to do a little bit of study every day?
I think it depends on how you like to study. But I think ramping up, so definitely in the first 6 months when you're just becoming a BPT, learning the ropes, don't put yourself under the pressure of having to study in hours and hours every evening. But the ramp up was in the lead up to the revision course and then after that. And I think I like to study smaller amounts in the evenings and then on one of the days of the weekend and then have the other day off. But I think it depends on like you as an individual, and there's no real, you have to do 5 hours a night, otherwise you're going to fail. I don't think there's like a set number of hours.
I think you do need to have a day off every week.
Yeah.
So even if you have an overtime shift, I think you should still have one of the days of the week off.
Did you guys study topic by topic? Like, because we're approaching study courses now, and we've done it. Should we just restart and do all the topics again, or?
So yeah, if you finished all the topics, including the like the weird ones like clinical, yes, I think spend some time on the weird ones because they're super high yield, and then by that time it'll be revision, and then you have to go over everything again after the revision course.
When did you start forming a study group from when you started teaching?
I think from the beginning. I don't know.
Yeah, like we did it from when we started, like, and you become like as in February. But some people started doing journal club in the last 6 months of their residency, which I think is a good idea. I don't really do that, but a good way of getting through some of the NEDGEM articles and trying to get used to it. But I think at least by March you should be starting.
And you can use the first few sessions just to debrief about what it's like on the wards as now the registrar, and sort of sharing your experiences with difficult bosses and good and bad juniors and things like that, and how you managed those situations. I think it's quite useful.
Do you usually form a study group with people in your network, or doesn't.
Yeah, I think from a logistical point of view, because you see them and you know their timetables a bit better, and your teaching is all happening so you can then do a study group after like a teaching session. I found it's easier, unless depends on which network, and if you're in a smaller hospital, then it can be harder. And Skype and things can be good.
I think some of the networks, like at North Shore, they have pre-arranged groups. Like you could request to be with people, but like everyone's in a study group.
I'm starting a new network. I don't really know anyone, so that's in February. But I guess
just let your deep.
Yeah, and they might they'll probably put you in a group if you don't already.
How did you go with study groups with people moving around to different rural secondments and the like?
We still meet once a week, so we do it from 6 till 9, so that if you're a night shift, you could still come, and if you're on a rural site, unless you're on an evening shift, you could phone in. We use Skype. Yeah. And I think it's also just about the habit, developing the habit, and you might not be able to come, but you can still prepare questions even if I'm not there to discuss them.
How did you approach sort of planning your time in the lead up to the clinical exam for the second time? Because it's a pretty short period of time after the written, and you would have had a fair bit of time ahead of you.
And I think that's the other thing that's heartening is you've got 6 months. I started again in February the year, and I just did 1 a week. And then it's good if you have a cohort of people, that have failed as well, and then you can get all the juicy cases while everyone else is still studying for their written. But yeah, I would at least start in February in my opinion. This must have more interesting things to talk about.
Any other questions, comments?
How did you go with your partner and like managing? Obviously, you had a wedding recently.
Yeah. It was quite hard. My husband's not a doctor, so I would recommend that.
Because they only
tolerate so much company, and then you have to move on. It was like it's a strain on your relationships, I think. But it's also good for perspective, because they're what really matter. But yeah, I think we got some advice to sit them down. That's bad news. I passed my written and now I'm going to do another exam. Because they often they're not doctors, they think it's all over. And you're like, oh no, there's more. But maybe just setting expectations.
There's a real thing called BPT widow that all our partners get called. Yeah. But I think in the clinical exam is a great opportunity to then use your medical and non-medical partners as bodies to practice and just get a really slick exam, and they kind of feel useful, and it's just like a fun thing after a few wines. And
I think you can drink more around the clinic.
Yeah, absolutely. Everyone case.
And because there's usually, I think, one night or one day. You do Saturday, don't you?
Yeah, Saturday.
But they all cohort will all get together, and at St George we did it on Thursday night, and then you can have dinner and drinks afterwards. So your partner can come to that too. They won't kill themselves for the bottom.
It's not medical, so I was just I've tried to explain the next
I think it's worth. It is worth being active and mindful about it, because it is a big deal. I think it's important.
I've got a puppy, so hopefully.
Oh, distraction.
Nice.
Questions or comments?
So what's the process like? So I know you have to take it into states. You can't take it in New South Wales. But then do they allocate it to you? Are there preferences? So they just kind of match you to somebody?
I think this year they let you, if you wanted to go to New Zealand, you could put in a preference, but in general, no, you can go anywhere. So I went to Perth. People go to Darwin. That's probably the furthest you can go. But usually a hospital will allocate enough time for you to get there to be ready. You have a day. If it's in Perth, they don't at least our hospital gave us the day before off, so you can fly and then not have to do the exam the next day.
Yeah, and I think there's enough people in the years above you that someone would have been at that hospital, so it's worthwhile talking to them about the way they run the exam and the kind of cases they have, if they're a transplant centre. So then you kind of know or a bit prepared, like if they do all the congenital complex heart things, then know some of the common cardiology shorts, because you probably may get one of those. So yeah, there's enough time for you to be able to prepare a bit as well.
Articles, so anything after 2017, they would have set the exam, like the articles that came out in April and stuff.
Yeah, I don't think any big articles this year would really feature in the exam, because it also takes time for that literature to filter down into common practice, and they're trying to set the exam for a general physician, and I think they do get physicians in other specialties to do those questions and see if it's reasonable. So they wouldn't expect really, really niche things.
One question. Does the college allow me to do their written exam and then have a year while still working, but then doing the clinical the next year?
Yeah, I think so, absolutely.
I think the college is very flexible, whether your workplace will be happy for you to do that. Because I think especially some of the more inner city hospitals, like there's quite a lot of pressure to get everyone in 2 years.
Yeah, so I think the bottleneck would be in your own hospital if they'll, so I know some people who didn't sit for personal reasons or health reasons, etc. But if your hospital's happy to re-employ you for an extra year, then
So we're all sitting, who's sitting 220 then? That was less than you.
plenty of time. And I think towards the end of residency, really enjoy that study-free time. Yeah. Some people started studying, but I think you've got so much time to study that don't kill yourself before you start.
Question. You listed the reasons why some people didn't pass, and one of them was like a lot of workload. If you're in the situation before the clinical examination, how do you prepare yourself?
It's a good question, and I think this is one of the things I would say it's not fair across all the networks, because some hospitals you have to work harder. I think it's always worth bringing it up. You might find you're the third or fourth person that's made a complaint and nothing's changed, but at least it's documented. And I think I failed because of my trouble with performing as well, but I had a term where before the first time that traditionally everyone who did that failed their exam, they were doing that term. And I think it's about making a choice in some ways, what you're comfortable with, and it's ethically, are you going to be more comfortable you looked after your patients, or, because it's not fair. And I think raising it with your DPEs is obviously important, and trying to get some extra support from your advanced trainees. But sometimes there won't be anything they can do. Do you have any comments on that, Jenny?
Yeah, I think it is hard, but I think if you have the mindset of when you're doing your job in your ward round, it's almost like doing cases as well. So having that mindset of learning on the job as well and practicing on the job, doing those checklists with the short cases on the ward round. So trying to maximise your time rather than thinking work is work and then study is a separate thing, because it does get really tiring. Yeah.
I think and again, it depends on your life. So I always run in the morning, so I wasn't willing to come in early, but I think it is good advice to come in before your workday starts. Come in at 7:30, start at 8:30, because they can't take that time away from you. And your mind's fresh. But it seems horrible, right? If you haven't finished till 8 the day before, to tell you to come back at 7:30. But
and if you haven't put in your preferences for your terms, try and not do the specialty that you want to do, that you need to impress your bosses and get good referees right before the clinical. So I chose to do medical oncology like in the term that overlapped between the end of the written and the beginning of clinical. So then by then, like, you didn't need to cram so much for the written, and you had this window of no study that you could just work hard at your job, impress the bosses so that they're confident with you. So then towards the end of that term, when you ask them, can I go away to do these cases, they sort of trust your judgment and things. So and you've got that rapport. I think that if you can, ask your network to preference your rotations that way.
And I think, like, back to your question too, is like, if you have raised it as an issue, you say, look, we're really not getting to any of this. The hospital doesn't come up with a solution for you, and worst case scenario, you do fail, then you have, like, you can go to them and say, I want a good term next year, you know, give me whatever the, like, I need a good term for the clinical, because at least you've raised it as an issue and in writing.
Yeah, and sometimes I think you just have to use a little bit of annual leave. So while you don't want to spend all your leave studying, it might be good to have a week in the middle of a very busy term that you can just use to do a bit of study and do some fun things as well. So then you're not as stressed. I haven't spoken much about, like, on the day for the written exam, but I think the similar things to the clinical don't, in the lunch break, talk about what everyone put for different MCQ questions in the first paper, because it's all submitted, it's not going to affect your marks. Bring, like, high sugar, glucose, lollies, chocolate things throughout the day. And then sometimes before the written, some people found listening to relaxing music and not cramming the whole weekend before the exam quite useful, because you don't want to swarm your brain with nitty-gritty facts that might influence what you put down as a rational answer for a question just because you read something about some new investigation for gout, which is probably not the right answer to that question. So, yeah.
Having a final word.
So, and getting lots of sleep, obviously. Like, don't go into the exam sleep deprived.
How did you sleep the night before?
Not very well. And I think not as well. I think the written was okay, but the clinical more so. Like, you're anxious, you're in a new city, and yeah, so it can be hard. Maybe exercise help a bit so that you're tired. But yeah.
I always used to go to a movie the night before exams, so your mind's off it, and go, like, maybe not a thriller or something, but just go for a nice meal and go to the movie. And then for a nice, relaxed, like, just
Okay. Okay, so you would have all got a little handout, and it's really nothing overly special. It's just, you know, I think most of what I've heard tonight from everybody has shown that really getting through your exam is largely common sense. And I know that sounds patronising and condescending, but I'm sure you've heard everybody talk about the fact that this is just an exam. You have a written exam and a clinical exam. You've done a lot of other exams in the lead up to these, and obviously you've made it through all of those to get to this point. You're going to do a written exam. Following that, you will either do a clinical exam in the same year or the next year. The key to sitting either of these exams is to talk to your supervisors, talk to your DPs, talk to the directors of training, talk to your peers, and talk to APs at the hospital and at your work. Talk to people who are mentors and who you can trust, and get their judgment on whether you are ready to sit the exam. The majority of people who I do talk to who have been unsuccessful in their exam have spoken to their DP and their supervisor and been advised that they weren't quite ready. So just keep that in mind. I know one of you earlier was saying next door that you made a decision not to sit the clinical exam because you just felt that the stress was going to be too high and you weren't ready. And that's a really smart move. Be kind to yourselves throughout all of this. The information that's in here has been prepared by our training support unit,
working in conjunction with my team to look after the assessment. And really one of the key things is to make sure you focus on your wellbeing. Make sure that you use your calendars, use organisers, and things like that very effectively to help you. One of the worst things that happens is people want to do the written exam and they forget to actually apply. And unfortunately, we can't take late applications because we close the applications, and all these dates on the website. We close the applications at midday on the 26th of November this year. We have to actually send everything out to get all your names printed onto exam papers and get all of that sorted and book your seats on that day. So technically we should close it on the Friday, but we choose to close it on the Monday. So we can't take late applications. It's always really hard when someone rings up at 4:45 on that last day and they go, have I just made it? We just missed it. And we just can't do anything. So use organisers and things like that. For those who want to sit the written exam next year, we are sending out reminders about applications being open, applications closing, and probably one that's something along the lines of applications are really, really closing now, so remember to do this. But put things into your calendar. So coming from tonight, that'll go in together with sleep, eat, meditate, all of those other pieces. When you go and do your written exam next year, it is a paper-based exam. So you will get the score sheets. Who was showing? Was it you who was showing us the score sheets you printed out? Yeah. You will get those. Remember to take a pen with you. And to give you some reassurance, when we scan the sheets, we do sometimes get calls from people who haven't passed the exam who say, I think I might have made a mistake when I crossed something out. I wrote my correct answer next to it and I mightn't have rubbed it out or something mightn't have shown. We have a team of people who actually go through and look for everything like that, and they go through every single possible permutation. If something doesn't scan properly, they look for marks that indicate what you may have wanted as your answer. They look for things that are written, all of those sorts of things. If you forget to write your name or your number on your score sheet, again, we pick that up. Hopefully not a whole lot of people have forgotten to write names and numbers on, but also those things are collected in a certain order. So we would generally be able to put them together and know who did what, but just remember to do those sorts of basic things when you're at your exam. If you go through your written exam and you have any problems or concerns on the day, make sure you let the invigilator know and make sure that they do make an incident report. Often we get told that something happened on exam day, but unless people have made it clear that it was a problem and a complaint, so if you just make an offhand comment to an invigilator about, oh, I don't like my seat, they'll go, oh, yeah, all right, and they'll walk away. What you might mean is, I don't like my seat because there's a gust of cold air blowing on my head, or I don't like my seat because I can't actually see anything sitting here. If it's that sort of problem, make sure you let them know. They'll fill in an incident report, they'll make you comfortable in a different seat where you can see or you're not freezing, and you'll be able to progress with your exam. It's much better to make a little bit of a fuss than to wish that you'd made a little bit of a fuss over something. You want to be comfortable, you've got to recall a lot of information. Trying to do an express version here. So, in terms of the actual exam questions, the questions are not designed to trick you. The fact that you're sitting here tonight, that you've all come from work today, or if you've had a day off, you've made the effort to come in here, means that you're at the right level to be actually going in and knowing what the questions are asking you. So, as was said earlier, this is kind of a link through to the clinical exam. So this is taking you from your work, testing your knowledge and your ability to apply concepts and information, and that will then progress you into the clinical exam. It's not designed to be a punishment, it's designed to make sure that you're at the level that you need to be to progress. So if you're not successful, it's just an exam. It's not the end of the world. You just do it again and you'll be grateful that you actually got the opportunity to stop and take that breathing space. I was talking to the now just stepped down chair of our clinical exam committee this year. And I was talking to him because I was very concerned about a trainee who had failed their clinical exam. And I wasn't quite sure what I could do to help the trainee. They were really quite certain that this was the end. The fact that they weren't successful in this exam was going to define their entire life. And he said to me, I failed the clinical exam the first time I did it. He said, I went in thinking I knew what I was doing and I thought I was fine. He goes, but I failed really badly, passed it the next year. He said, because it was just the kick I needed to make me realise the things I needed to focus on and the fact that it was just an exam. He said he credits failing that exam with making him a better physician. He said, had I passed in that first attempt, I would not be who I am today. That helped me to learn humility, helped me to learn more of what I needed to know, and it made me go and seek the experience and the guidance that I needed to be able to actually get through the exam the next year and to go on and have a very, very good career. And so failing the exam is not the end. You may well still come back as the chair of a clinical exam committee if you feel like holding down 2 full-time jobs and doing some counselling along the way. So please focus on the fact it is just an exam. The college has a lot of resources available, both to help you prepare for your exams. We do have the college learning series, and I'm conscious there's not that much in PEDS. It is in development. Not that much.
There's none.
We're working on it. But there are other resources and links that you can go to, and I think you've got a really strong sort of group in PEDS where you do network, you do talk and you do support one another. So just hang in there for the learning series. Those who are doing the written exam next year, the full sets of questions from the written exam this year are still available on the website, and they don't have answers to them, but that's so that you can go and find those answers. A lot of people actually said they help them, they sort of use those for their study in that couple of weeks after the episode. Help them to structure what they were looking up and where they were going to. So do go and use those. Have a look at the handout. There's some other resources listed on there. And also go and talk to your supervisors and your DPEs about where there's other access to resources. If you are feeling stressed for your exams, the college has Converge International, which provides services and counselling services, etc., and they can be made available face-to-face if you wanted. They can also, we can have counsellors sent out to the hospital, or you can go somewhere and do that, or do it over the phone. So don't let the stress or the anxiety get to you. And if you are unsuccessful in the written exam or in the clinical, please make use of those services. Look after yourselves, because there'll always be another exam. There won't be another you if anything happens. So that's a really important piece. I'm trying to really hurry you, but as you said, there's a short period between the written exam and paediatrics clinical. So you do need to knuckle in and really start that study. But keep thinking about the fact that the clinical exam is just a formal way of testing what you do on the job. So don't make it seem like the mountain of doom. It is actually testing on what you do on the job. So if you go in and do the things that you've been told you do well at work, that's what's going to help you out there. For your clinical exam, you will need to travel. I'm sure you're all aware of that. You can't do it at a site you've worked at, unless there's special circumstances. We do try to not have you examined by anybody you have ever worked with. If on the day of a clinical exam anything occurs that seems untoward, or if there's anyone there that doesn't make you feel comfortable, please make sure you tell the chief examiner or alert somebody. Again, with all exams, if we hear about something afterwards and nobody's documented anything and nothing's been raised, it's really hard to do anything. And for me to be able to protect all of you, I need you to be making those comments to people. So if there is anything that doesn't feel right, please raise it at the time. the clinical exams, you get your allocation, and then you'll get that at least 6 weeks out from when you need to go to the exam, so that you'll be able to arrange your travel. And then you'll obviously, hopefully, be going with friends so you can go and stay somewhere nice. Some did in New Zealand this year. They had a lovely time. Then the results for your clinical exam will come out. You'll get an email saying you passed or failed. But 4 weeks after that, you actually get copies of feedback that was written by the examiners on the day, so that if you're not successful, that can actually help you prepare for next year. It doesn't have the examiners' names and it doesn't have the patients' names for privacy reasons, but we do actually make sure that you get copies of that. If you're not successful in the clinical exam, that will be sent to a member of the National Examining Panel who will sit down and go through it with you. And the reason we do that is not so that people can have to go and face up to someone. It's so that people who weren't successful actually get the context around the comments and the feedback that's been provided. So it's not a punitive thing. It's done purely to support people, because we all know that if we're not successful at something, we start reading messages that aren't there and things. I'm just going through, if I've missed anything, absolutely critical. We've been through study groups, been through all of those sorts of things earlier. Everyone's explained how they do or don't do their study groups. So I'd probably rather now stop prattling on and just see if there's any questions or any concerns. I mightn't be able to answer everything tonight, but might be able to make more information available on the website as well for people.
It's a very specific question. Just regarding the written for the multiple choice, is that going to be pencil or pen?
It's pen.
Okay.
Yeah.
So I heard various things about it. It's very confusing. So if you mark the wrong thing, there's like a specific sequence of events that you're meant to do, or steps of how to write the correct answer.
Oh, yeah. You colour in the thing. If you realise that you coloured in B and you wanted to colour in A, cross out B, just put an X through it and colour in A. If you don't think that we're going to understand that, write A next to it.
Okay.
And whilst my team won't enjoy their day picking through the anomalies, they will find that you meant A.
So theoretically, let's say you just scroll through all the answers. If you just cross everything out and leave something written, they'll just interpret
we'll pick that up.
Okay.
As long as it's clearly crossed out. So some people will cross, some people scribble, some people obviously get really angry with the wrong answer. They really work on crossing it out, but we pick that up too. We look for everything, and then if we can't determine it, we'll actually have 3, 4, 5 or 6 people have a look. Yeah.
And then say if you change your mind again and you want the original answer, can you just do an arrow pointing that you want the one that was crossed
An
out?
arrow is probably a bit much for us. We live on caffeine and chocolate at that time. Probably if you just cross out the new answer and just write beside it what one you wanted. So just, rely on the crossing out and the writing if it comes down to it.
Why not just use pencil?
Really trying to rub out properly pencil in one of those little circles.
Yeah, mine really.
Yeah, it doesn't work that great. So what happens is the machine reader picks it up. And so then if you've tried everything, you've coloured in A, B, C and D. And maybe this is why we've gone to 4 options, because it used to be A. You've coloured them all in, it reads them all and it tells us there's a problem. We've got to go back and figure out which one's coloured in the darkest. So, yeah, we moved on to pen, and it used to be the machine readers would only read pencil. That was the reason there. They've advanced.
I think if there are some questions where you're not sure about, and if we're allowed to bring in pencil, I think what I did was use the pencil to mark and circle or star the questions that I wasn't sure about, rather than leaving it blank. Because if you leave something blank, there's a high chance you forgot you left it blank, and then the next question you put the thing in the wrong column, and then you can go back and rub out all the pencil.
Do it really light.
Yeah, and just make sure that you rub out all the pencil at the end. That's one other way of managing it.
Anything else?
Is there a guarantee that for everyone who passes the written exam, there will be questions for the exam?
There is, yeah. Any other questions? Yeah.
Can I ask why you did go to 4 questions over 5?
Yeah. There's a few reasons. So I don't know if you've ever tried to write a multiple choice question or if you've looked at some that do have 5 options. The most common thing internationally is to use 4, sometimes 3. When you're writing 5 option questions, oftentimes people write the correct answer, they make a correct answer. They can come up with 3 plausible distractors, so things that would be common errors that people would make. Coming up with a 4th one often becomes a little bit too creative. And so when you do analysis, generally around 95.4 approximately % of items that have 5 options have one option that regardless of the number of times that item is used, it's never been selected. And that's usually because it is so clearly incorrect that there's no point having it there. So all you're doing is making people spend their time reading it in an exam, and every minute counts. And you're also putting something in there that if the question has any sort of ambiguity in it, it risks actually tricking the people who are doing well on the exam into putting an incorrect answer just through the fact that it becomes confusing to read. And so then you're actually undermining why you're even doing an exam. So we made a decision when we did our analysis, we did come up with the magic 95.4%. And we said, well, we're not going to actually use 5 options anymore while we're using this exact testing format. So where we're having this particular number of multiple choice and that particular test design. Anything else?
Are there still extended match questions as well?
There are, yeah. And I can't remember the exact number. I think it's 8 and 3 or 6 and 3. All right, thank you. And you've got your handout?
Yes.
So good luck.